The Social Security Administration recently implemented a change that has millions of retirees carefully examining their bank statements. I want to explain precisely what is occurring because the misinformation circulating is truly irresponsible. Having spent many years assisting individuals with their financial planning, I understand that when it comes to Social Security, the confusion and outright falsehoods spread online are causing genuine harm to people who have worked their entire lives for these benefits. So let us dispel the myths immediately. Here is what is actually happening. There has been a significant adjustment to Social Security payments for this year, and yes, some recipients are noticing approximately $200 more per month in their benefits. However, and this is crucial, it is not a universal payment distributed to everyone, and comprehending who qualifies could determine whether you can rely on that money arriving or be surprised when it does not appear. The cost of living adjustment for this year came in at 2.5%, which translates to different dollar amounts depending on your current benefit level. For the average retiree receiving around $1,927 monthly, this cost of living adjustment means roughly $48 more per month. But here is where it becomes interesting, and where that $200 figure actually applies. Before we proceed, I need you to grasp something fundamental about how these discussions should be approached. I am not here to sell you false hope that does not exist, and I certainly will not soften reality just to make you feel momentarily better. What I will do is provide you with the straightforward truth about what is happening with Social Security currently, who is actually receiving this money, and what you must do to ensure you are not missing out on benefits you have earned through decades of hard work. The issue with most information circulating online about Social Security is that it is designed to attract clicks rather than genuinely help you. People throw out these headline numbers without explaining the context, without breaking down the eligibility requirements, and without acknowledging that Social Security is not a one-size-fits-all program. Your neighbor might be receiving a completely different benefit amount than you, and that is not because the government favors them more. It is because Social Security calculations are based on your earnings history, your filing age, your work credits, and a multitude of other factors that most people have never taken the time to understand. So let us discuss this $200 figure and where it truly originates. The 2.5% cost of living adjustment for this year is absolutely real and is already being applied to benefit checks. But when you calculate the average retirement benefit of about $1,900 a month, that cost of living adjustment works out to somewhere around $48, not $200. Now you might be thinking that I just said people are getting $200 more, and now I am saying it is only $48. What is going on? That is exactly the right question to ask, because this is where understanding the details becomes absolutely critical to your financial well-being. The individuals who are actually seeing increases in the $200 range or higher are typically those who were already receiving above-average benefits before this cost of living adjustment took effect. If you are receiving the maximum Social Security benefit, which last year was around $4,700 for someone who retired at full retirement age, then a 2.5% increase puts you at an additional $117 or so per month. But if you delayed claiming until age 70 and you are receiving closer to that maximum delayed retirement benefit, which can exceed $5,800 monthly, then yes, your cost of living adjustment could push you into that $200 range or even higher. However, here is something that nobody wants to talk about. Less than 6% of Social Security recipients are getting anywhere close to the maximum benefit. The vast majority of retirees are working with that average figure of around $1,900, which means their increase is going to be proportional to what they were already receiving. Now there is another group of people who might be seeing larger increases, and this is where things get interesting from a policy standpoint. If you are receiving both Social Security retirement benefits and Supplemental Security Income, or SSI, you could be looking at a combined increase that gets you closer to or even exceeds that $200 figure. SSI recipients receive their own cost of living adjustment, and when you stack that on top of your Social Security cost of living adjustment, the combined effect can be substantial. But again, this is not free money appearing out of nowhere. This is an adjustment meant to help your fixed income keep pace with the rising cost of groceries, utilities, healthcare, and all the other expenses that have been eroding your purchasing power. Let me be perfectly clear about something, because I believe this is where much of the confusion and frankly a lot of the anger originates. Cost of living adjustments are not bonuses. They are not rewards. They are not the government being generous with your money. Cost of living increases are designed to maintain the purchasing power of your Social Security benefits in the face of inflation. Think about it this way. If everything at the grocery store costs 2.5% more than it did last year, and your Social Security check remains exactly the same, you are effectively taking a pay cut. You can buy less with the same amount of money. The cost of living adjustment is supposed to prevent that from happening, to keep you from falling behind as prices rise. But here is where I get frustrated with how this entire system operates, and I will be honest with you about this. The way they calculate inflation for Social Security purposes does not always match up with the reality of what seniors are actually spending their money on. They use something called the Consumer Price Index for urban wage earners and clerical workers, which is a mouthful, and it is based on the spending patterns of working-age people, not retirees. Seniors typically spend a much larger portion of their income on healthcare and housing, and those costs have been rising faster than the general inflation rate for years. So even with this 2.5% cost of living adjustment, many retirees are going to find that their actual expenses are still outpacing their benefit increases. That is not pessimism. That is just mathematics and reality colliding in a way that is not particularly comfortable. Now, let us talk about eligibility, because this is where I see people making mistakes that cost them real money. The cost of living adjustment increase is automatic for everyone receiving Social Security benefits. You do not have to apply for it. You do not have to call the Social Security Administration. You do not have to fill out forms or prove that you need it. If you are getting Social Security retirement benefits, disability benefits, or survivor benefits, the cost of living adjustment gets applied to your payment automatically. It showed up in your late December payment or your January payment, depending on when you normally receive your benefits. If you did not see an increase in your check, that is when you need to pick up the phone and call Social Security because something is wrong. But here is where people get tripped up, and I want to make sure you are not one of them. Even though the cost of living adjustment increase is automatic, there are other benefits and programs that you might be eligible for that absolutely are not automatic. There are millions of dollars in benefits that go unclaimed every single year because people either do not know these programs exist or they assume they do not qualify without ever checking. We are talking about programs like Medicare savings programs that can help pay your Medicare premiums, deductibles, and coinsurance. We are talking about the Supplemental Nutrition Assistance Program, which used to be called food stamps. And yes, seniors on Social Security can qualify depending on their income and assets. We are talking about state-specific programs that provide property tax relief, utility assistance, prescription drug coverage, and a whole host of other benefits that can add up to way more than $200 a month when you stack them all together. The reason these benefits go unclaimed is partly pride. I will be honest about that. Many people who work their entire lives and paid into the system feel like applying for assistance is somehow shameful, or that they are taking something they have not earned. I want to challenge that thinking right now because it is costing you money, and it is based on a fundamental misunderstanding of how these programs work. If you paid taxes for 40 or 50 years, if you contributed to Social Security through every paycheck, if you played by the rules and did everything you were supposed to do, then accessing the benefits that you are legally entitled to is not charity. It is not a handout. It is you collecting on a promise that was made to you in exchange for your lifetime of work and contribution. The other reason benefits go unclaimed is pure complexity. The system is confusing by design, or at least it feels that way sometimes. You have federal programs, state programs, county programs, and nonprofit programs, all with different eligibility requirements, different application processes, and different deadlines. It is overwhelming, especially if you are trying to navigate it on your own without help. And that is exactly why I am taking the time to walk through this with you, because I do not want you to miss out on money that could make a real difference in your quality of life just because the paperwork is intimidating or because you do not know where to start. Let me provide some broader perspective on what we are really talking about here, because this issue goes far beyond numbers on a spreadsheet or a line item in a budget. Social Security is not a supplement for most Americans. It is the foundation of retirement income. About 90% of people age 65 and older receive Social Security benefits, which already tells us how universal and essential the program is. For roughly half of elderly beneficiaries, Social Security provides at least 50% of their total income, meaning their financial stability rises or falls with that monthly check. And for about 1 in 4 seniors, Social Security is virtually their only source of income. There is no backup plan, no second pension, no investment portfolio waiting in the wings. These are not abstract statistics or talking points for policy debates. These are real people, retired teachers, factory workers, caregivers, veterans, who are trying to maintain a basic sense of dignity and independence in their later years. Many of them live on fixed incomes that simply do not keep pace with rising costs for housing, food, healthcare, and utilities. Inflation does not pause just because someone is retired, and expenses do not magically shrink with age. In fact, for many seniors, costs increase precisely when earning power disappears. So when we talk about a $200 monthly increase, even if it applies only to certain beneficiaries, we are not talking about luxury or comfort. We are talking about survival and quality of life. That $200 can mean the difference between filling all prescribed medications or stretching pills and skipping doses to make them last longer. It can mean the difference between keeping the heat on during the winter months and sitting in a cold apartment wearing extra layers to save money. It can mean being able to afford basic dental care, eyeglasses, or a doctor's visit instead of postponing treatment until a small problem becomes a serious one. It can also mean the difference between connection and isolation. For many seniors, that extra money could cover gas to visit grandchildren who live across the state, or a bus ticket to see family they haven't hugged in months or years. Without it, they stay home not because they want to, but because they have no financial room to move. These are the small human moments that make life feel worth living, and they should not be out of reach for people simply because they grew old. This is not theoretical. This is not abstract economics. This is real life for millions of Americans who worked for decades, paid into the system, raised families, built communities, and helped create the prosperity the country enjoys today. Asking them to struggle in their later years choosing between health, warmth, and connection is not just a policy failure, it is a moral one. These people did not ask for special treatment. They earned security, and at the very least, they deserve to age without fear, instability, or indignity. Now, I know some of you are sitting there thinking about the long-term sustainability of Social Security, and that is a valid concern. The Social Security trust funds are projected to be depleted by 2034 or 2035 depending on which analysis you are looking at. And if Congress does not act before then, benefits would have to be cut by about 20% across the board just to match incoming revenue. That is a scary prospect, and it is something that absolutely needs to be addressed. But here is what I want you to understand. Worrying about what might happen in 10 years does not change what is happening right now. And right now, you have benefits that you are entitled to, and you should be claiming every single dollar that is legally yours. The solution to Social Security's long-term problems is going to require political will and difficult choices about taxes, benefits, retirement ages, and means testing. Those are conversations that need to happen at the national level, and they are going to involve trade-offs that nobody is going to be completely happy with. But while those debates are happening in Washington, your bills are due today, your medications need to be refilled this week, and your financial security cannot wait for politicians to figure out their messaging strategy. So here is what I want you to do, and I am being very specific and very direct about this, because I want you to take action, not just nod along and then forget about this conversation 5 minutes after it is over. First, if you have not already, Go look at your most recent Social Security statement and verify that the cost of living adjustment increase was applied. Your payment should be 2.5% higher than it was in December. If it is not, call Social Security immediately. Second, visit the Benefits Eligibility Screening tool on the official government website and spend 20 minutes answering questions about your income, assets, and circumstances. This tool will tell you what programs you might qualify for, and yes, you might be surprised at what is available. Third, if you are eligible for anything you are not currently receiving, start the application process. Do not talk yourself out of it. Do not convince yourself it is too much hassle. Just start the process and see it through, because that is how you turn eligibility into actual money in your bank account. Remember, navigating these systems can feel daunting, but you do not have to do it alone. Consider reaching out to local senior centers, nonprofit organizations, or trusted financial advisors who can guide you through the process. Every dollar you claim is a dollar you earned, and it can provide not just financial relief, but peace of mind. Your retirement years should be a time of reflection and enjoyment, not constant worry over making ends meet. By taking these steps, you are advocating for yourself and ensuring that you receive the full support you have rightfully earned through a lifetime of contribution.